Hello, I'm Dr. Bello. I'm the director of our behavioral health services here at Care for the Kids Foundation, and I also direct our Storybook Homes long-term follow-up clinic, which is our childhood cancer survivor clinic. I am a board-certified neuropsychologist, which basically means that I'm a licensed psychologist, but I also have extra training and fellowship training in brain-behavior relationships. I'm one of the few board-certified neuropsychologists in our state, and I'm here at Care for the Kids. Sometimes children that we see here at the clinic have difficulties in their thinking skills or their emotional functioning because of things that are going on in their brain. So for example, if a child has a brain tumor or stroke, those things directly impact the brain and can impact their functioning. And one of my roles is to determine what else needs to happen for this child and how it affects them. Another thing that happens for kids in our clinic here is that they have treatments, and sometimes these treatments like chemotherapy and radiation can also cause problems in their thinking skills. So even after they're done with treatment, they can see later effects in their attention or their focus, memory. And so my job again is to evaluate, are there concerns in these areas, and then to determine what kinds of things can help this child. Finally, a child can have problems in their thinking skills because of developmental reasons. And what I mean by that is that maybe how their brain was formed or genetics, they inherited some different things that cause school and learning new information to be more challenging for them. So basically, you have a number of things going on for a child. You have whatever is the disease that may be causing problems on their brain and their functioning and their thinking skills. You also have any treatments, so as I mentioned, some of the medications that are given to help the child and cure the illness that could cause problems in their thinking skills. And then you have development, where the child may already have had some problems in their thinking skills, and that's added on top of that. So all these things together can make some difficulties for a child. And so my role is to find out what is going on and what recommendations we need to make and help them. There's different resources that we can use in the classroom or outside of school, and different therapies and rehabilitation treatments that can help the children. I also have a role in our comprehensive clinics, which basically are clinics that are geared toward a specific disease or diagnosis. And my role in those clinics is to screen for a person's thinking skills and their cognitive functioning, as well as their emotional functioning and how they're coping with whatever illness it is. And so these are more briefer assessments as opposed to the longer assessments that I typically do. As director of the behavioral health department, I manage a team that focuses on the psychosocial needs of our patients and families. And basically what that means is that we look at how people are coping emotionally with diagnosis and their treatment. We offer any support and services they may need and determine next steps for what can help them after treatment. The Storybook Homes long-term follow-up clinic is a childhood cancer survivor clinic that focuses on our survivors. So patients that are at least 2 years off of treatment that are now moving on with life and have survived cancer. And as director of that clinic, my role is to make sure that we are giving patients the best care and the most up-and-coming treatments and monitoring and screenings that they need. Many patients have a history of receiving chemotherapy or radiation, and those can cause lasting effects on different body systems. And so in our clinic here, we monitor those different effects to make sure that there aren't any concerns later on that might occur. And so patients are seen usually yearly in our clinic.